All right. Well, good evening or good morning, everybody. This is the Jared Gladys Society's conversations with our members. I am Alvin Jones, a pediatric orthopedic surgeon at the Dayton Children's Hospital in Dayton, Ohio. And Jamil, why don't you go ahead and give introduction to yourself?
Hey everyone, my name is Jamil Kendall. I'm a current PGY3 in orthopedic surgery at Oregon Health and Science University in Portland, Oregon.
All right, and go ahead and introduce our guest that we have today.
And today we're happy to welcome to join us this morning Dr. Barrett Woods. He is a spine surgeon out at the Rothman Institute and Thomas Jefferson. Dr. Woods did his undergraduate studies at Clemson University and then proceeded to go to medical school as well as residency at the University of Pittsburgh. He then went to the Rothman Institute for his fellowship in spine surgery, where he stayed on as faculty. Thanks so much for joining us this morning, Dr. Woods. If you could go ahead and kind of, introduce yourself, share a little bit about how the journey that you've taken to get to the point where you are right now.
Sure. Thanks, guys, for having me. Always a pleasure. It's a small world. Alvin called me to ask me to do this, and I've known Alvin 10 plus years. I'm from Pittsburgh and went to medical school at University of Pittsburgh, and Alvin was a year ahead of me in medical school. And as soon as I met him, he extended his hand to me. And just seeing him there was something that gave me a lot of confidence because he walked like me, talked like me, and he definitely extended his hand. And so it's really cool to see him doing so well. And he calls me 10 plus years later and asks me to do this. It's something that really makes you smile and makes you realize how important these connections are. I'm from Pittsburgh, grew up in inner city Pittsburgh. I was very blessed to have a two-parent household. That was certainly not the norm in my community. Growing up in the early 90s, in the environment I grew up in, there's a lot of violence, drugs, a lot of distractions. And sports was really a conduit for me in order to kind of keep me out of trouble. There was structure in our home, so there was an expectation that was set forth by my parents for us to excel academically, and that's not something that my peers necessarily had. And so that mixture kind of allowed me to find my way and to get interested in orthopedics through sports. I went to Clemson University, and I remember coming home during a break, and I met a Black orthopedic surgeon named Craig Bennett, who was the team physician for University of Pittsburgh basketball at the time. I had some friends who were playing basketball for Pitt at the time, and so I went to a game, and I watched the game, but I was more enamored by seeing the Black physician on the sideline. And I went up and introduced myself to him, and he immediately took me under his wing. And that was something that really was kind of the first block to make me say, this is something that is not only possible, but this is something that I want to do. And so that desire only grew as I, got through medical school. Being from Pittsburgh, there was I wasn't around many Black physicians initially. In my community, certainly that's not something that we saw on a regular basis. And I met a Black cardiothoracic surgeon named Dr. Bennett. I followed him around for quite some time. He introduced me to a society called Gateway Medical Society, which is a multi-specialty group in Pittsburgh, African-American physicians. And so that was really another inspirational moment for me, being around all these Black physicians. Again, only, fueled the fire. I went to medical school, met brothers like Alvin, and there was several others. We had several other brothers in the medical school at that time, Ryan Brandon and, great guys who I'm friends with to this day. And when I got to medical school, I actually tore my ACL, and Freddie Fu, who was the chairman of orthopedics at the time, did a double bundle reconstruction on me. And that was novel at the time. That was fascinating. And then I began to do some research in disc degeneration in the lab of James Kang, and that's what really sparked my interest in spine surgery, and it was off to the races from there.
Nice. And so right now, you are doing spine surgery at the Rothman Institute, correct?
Yeah, so this is my 5th year in practice. It's crazy how time flies, man. It's just 5 years I've been in practice now. I do mostly degenerative adult spine care, but my practice kind of has the full gamut. I have a hospital in the community, so I can have a community hospital setting I practice in. I also work at Thomas Jefferson, where I have fellows. And I do mostly degenerative stuff, but take a lot of spine trauma call and also do some deformity as well. Also, Rothman Institute requires us to stay academic, and so we all are involved in various research studies and projects that we are fascinated and interested in. So it's really is a great practice setup and environment.
Now, out of your colleagues, how many else are African American at the Rothman Institute?
So there are 200 physicians at Rothman Institute. Of the surgical partners, I think there's about 75 or 80 surgical partners. Chris Dotson is the team physician for the 76ers. So he's one, and then Summer Hamoud is another. She is the only female minority partner, and she's a sports surgeon who is also a minority. And then my wife is another minority physician. There's a couple of non-operative minorities. Chris Radcliffe as well is a spine surgeon. That's it. So there's about probably 5 or something like that out of 200.
That's one of the questions I wanted to kind of see is how's the being one of the few African American spine surgeons or orthopedic surgeons in in that setting, like you'll probably get a good deal of Black patients from the inner city as well. Have you seen that affect your interactions with your patients, or how you deal with them, or how they perceive you?
Well, I think one of our blessings and gifts is our ability to communicate and relate to people. We have the ability to communicate with an older Caucasian lady, make her feel comfortable, as well as the inner city guy who broke his neck, was in a car accident or something of that nature. And I think in regards to development of my clinical practice, the ability to communicate and relate to people is one of the things that has helped facilitate my career and help my clinical practice grow to the volume that it is now at this point. I know African Americans particularly, have some hesitancy to receive medical care. We start talking about spine surgery. Most people are apprehensive about spine surgery at baseline, let alone minorities. And so it is something that is incredibly gratifying when a patient, African American patient, comes to the office and they have some severe pathology. And typically what I see, particularly in the elderly African American population, that they have advanced pathology. Myelopathy is very common, and these patients have kind of trudged along for years and just have had progressive functional decline. And then you can relate to them, you make them feel comfortable, you perform an operation on them, and then just kind of their amazement and shock and awe that what you did for them actually made them better is something that is very, very gratifying.
I'm sure they go back and they spread the word, and then that's the quickest way to get your patients to grow. Yeah.
Good question. Word of mouth is by far kind of the biggest way that you can grow your practice. That's why you treat everybody with love and respect, and that doesn't mean they're always going to like you, because I got plenty of patients who I tell them they don't need an operation, and sometimes They don't like to hear that, but certainly they know I'm telling them the truth, and I'm giving them an honest assessment about what the best thing for them is. And that's required at baseline. That truth and honesty, couple that with compassion and ability to relate to people, and finally your surgical skill and technique indications you're going to do quite well.
Yeah, I hear what you're saying. I know sometimes when people come in and they have a pain issue, and these MRIs can show disc bulge, and bulging is one thing, but it doesn't necessarily mean that it's causing you that pain and that problem. And they think you're trying to keep the antidote from them, So yeah, I can understand that. But yeah, tell us a little bit about how things are going outside of medicine for you. Family life, anything you like to do outside of medicine?
So my family's great, been incredibly blessed. You know, COVID it was a very challenging year for all of us last year. Luckily, you know, my family is safe. You know, my parents still are thriving and kicking in Pittsburgh. I got two brothers who are doing quite well. One of my brothers is a lawyer at Tesla, and my other brother is a business guy in New York. And my family, you know, I got three sons. Barrett is 7, Winston is 5, Roman is 3, and my wife is a physiatrist within the practice that I work in. So we're blessed, man. Life is good. You know, we're thriving despite the circumstances, and so not much to complain about. In regards to what I like to do, I grew up playing basketball, but you start getting old, you worry about tearing an Achilles. I already tore my ACL. I can't be out of work. So, you know, I really got the golf bug maybe about 10 years ago. One of my mentors, James Kang, kind of planted that in me. You know, he took me golfing and he beat me pretty soundly. And so that was something that kind of inspired me to start trying to play the game of golf. And I enjoy doing that. So golfing and working out outside of work are the two things predominantly that I do in regards to just trying to relax and unwind.
So, do you think your golf game is up to the point that you could challenge Dr. Kang?
I don't think so yet. I mean, I don't want to tell him that, but I think he still got me. But that's why they play the game. You know, you go out, you never know what can happen. So I won't tell him that. But every time I see him, I tell him I'm coming for him. I'm chasing him. So you better keep running.
Yeah, I've started to feel that lure of the golf, but I'm not as consistent to where I'm getting better. But I've started, I'm good on the irons. No, it's the drivers. You know, those are like the hardest ones. If I can get that down, then I'd probably have a decent game.
Golf is a beautiful game. You know, it's really something that you're really battling yourself, but you know that competition level is really high. So Charles Nelson is, you know, obviously a foundational member of Glad Society. You know, he's a full professor. He's influenced, you know, a number of our careers. And so he lives not too far from me. We're members of the same golf course. And so I very frequently play with Dr. Nelson. And, you know, I told him I wouldn't call him Charles until I beat him on the golf course. So once I finally beat him, now I can say Charles every time I see him. And he was Dr. Nelson until I could beat him in golf.
That's awesome. I like that. Okay, awesome. Go ahead, Jamil. Jamil, you want to ask Dr. Woods a question?
Yeah. One like funny note. Dr. Nelson's niece actually grew up with me down in the Virgin Islands. Yeah. He has a niece that I went to
he has a brother that's a physician in the Virgin Islands or something.
He does, yeah. His brother, I actually worked with him one summer when I was in undergrad. Kind of doing some filing for him, figuring out my interest in medicine and whatnot. So very small world, very, very small world.
There it is, a small world. Yep.
But I did want to ask you, you know, I'm a third year, getting ready to start applying for fellowships, thinking about next steps, thinking about what my career is going to look like. There are a lot of things that I haven't experienced yet. You know, and you at your stage now, 5 years in practice, I'm wondering if you can, you know, maybe drop a gem or two, things that you've learned at this point that you wish you knew when you were at my stage.
I mean, I think so. The advice changes for whatever level you are at in your career. I mean, from medical student, the challenges as a medical student are going to be different as a resident, and then as you're preparing to enter the workforce, you know, it's a unique time. There's a lot of unique challenges which weren't necessarily present in the past. COVID, consolidation of the private practices into larger practices. You know, most orthopedic surgeons do not stay in their first job. I mean, I'm in 5 years in practice now. A lot of guys that I started with, not in my practice, but who I knew across the country, are on at least their second, some of them on their third job, you know. And one of the best pieces of advice that I heard when I was going through the process is that it really takes 7 years to build a practice. You need to be in one place for 7 years to firmly establish yourself. And so if you pick the wrong job and you're bouncing around every 2 years, it's really challenging for you to kind of establish a name within the community, a foothold within the community. And so that transition from residency to fellowship is one thing. The goals of that transition are for you to really kind of fine tune your surgical skill. I think really the art of medicine is understanding who you need to be doing surgery on and who you don't. And that's something that you try to cultivate while you're in fellowship. And then, figuring out and being honest about the things that you're capable of doing and what you're not. I mean, one of the biggest problems people have is ego. It's try to start practicing doing things more than they should be doing. And perceiving that as a sign of weakness, but when, not understanding your limitations, and not just your limitations, but what the limitations of your hospital system are. If you don't quite grasp that, you put yourself in a situation not to be successful. So I think, that transition from fellowship to practice is one that's critical, and it's important to get right. Most people get it wrong. And I think that's the beauty of the Gladden Society. You walk into a Gladden Society meeting and you will meet community superstars. You will meet people who are at the upper echelons of academic practice. You will meet researchers, and so having access to people who have taken different paths is important. And then, what you think you want now may not be what you want down the line, once you actually get to that position. I think I have a perfect situation for myself. I always envision myself being in an academic setting. And I have kind of a private-demics model where I have the best of both, in which I have a private community hospital where, I'll do 5 or 6 operations in a day with my physician assistant and his clockwork, and everything is done. And then I have a academic component to it as well, where I teach residents in the Thomas Jefferson University, sprinkled in with my research requirements and interests. So that works perfectly for me. And, what you think you may want may not be actually what you want as you start going down the line. So I think it's important to explore, kind of all the different avenues, talk to a lot of people. Contracts is another big thing that no one taught you that in fellowship or residency. So I think you got to lean on the people you can trust. And I think that's the beauty of the Gladden Society, is that you got somebody at every stage of the game that you can reach out to, and through the efforts of Jason and Alvin, trying to interconnect everybody so that you could easily access and shoot somebody an email, say, hey, man, can you look at this contract? Does this make sense? Does this practice situation sound right to you? What are the questions I need to ask this practice as to why they're hiring me? Those are the things that you really need to be cognizant of. And I think, the mentorship and the guidance that you receive in Gladden can help you kind of answer those questions, put yourself in the best position.
That's some sound advice.
Yeah.
Very good.
Yeah.
Yeah, as you were saying that, it gave me I guess it's the old phrase, or I don't know if you heard it, Barrett, but what I was told was, in residency, you're learning how to operate. In fellowship, you're learning when to operate. As an attending, you're learning when not to operate. And so at those different stages, you're actually coming to those realizations of, indication. As a resident right now, basically, just do your best, get in the OR, learn as much as you can about operating, because the next step, you're going to be honing your indications for your specialty on when to operate for your specialty. And then as an attending, you just got to really start to know your limitations and be able to say, no, I don't think I can help you. When, some patients come in and they want you to operate. Dr. Woods was just talking about how, he'll have to tell some patients that, I don't think you need this. And, it may be a burst to their bubble, but it's the truth. So that, I think that was some sound advice. So before we go, I like to ask 2 questions to our members when we're on the video chat. One is, what do you want to see from the J.R. Gladden Society? How can we be more supportive to you as a member? And then what do you think you could contribute to the society so that we can accomplish our mission, which is to increase diversity within orthopedics, make sure that we give excellent musculoskeletal care to our underrepresented patient population, and then also supporting the needs of our minority surgeons?
Well, I mean, I think, the GLAD Society is an incredibly powerful organization. We had talked a little bit earlier offline about it, but I remember walking into my first J. Robert GLAD Society meeting, and it's really hard to put into words the euphoria that I felt being surrounded by, this excellence, of every stage. Medical students trying to become surgeons, residents, fellows, and then, community superstars to the Cato Lorenzens and Eric Carsons and guys that are at the pinnacle of orthopedics. Augustus White. I remember meeting Augustus White, and just, it was like meeting Michael Jordan, as a spine surgeon, someone that's aspiring to do spine surgery, looking back at, his seminal biomechanical studies, the foundations of the things that we do. And so, it was such a powerful and a euphoric experience for me, and one that was really transformative to me. And, that has never left me. I look forward to going to the GLAD Society every year. I mean, I'm up for associate professorship now. I just put my application in. 4 or 5 of my letter writers are all GLAD Society members that I met over the years. And so the connection, the inner network of people, the Black excellence on display is something that is incredibly inspiring. And that's something that, that it needs to be exposed, to the masses. And I think that, things are changing in regards to technology. We have the senior statesmen whose presence is incredibly important, because they always remind us of the past, of the challenges and struggles, and to see what some of these men and women have been able to accomplish in their careers during the era that they did it should be inspiring to anybody. To really, raise your ceiling of expectation for yourself. With that said, there also has to be some transition, and, you have to have, the younger generation of people also actively involved. And I think the GLAD Society is doing a great job. Jason Brooks is an incredible brother, highly motivated. Nicholas Hogan, yourself, Adisu Mesfin, there's this younger generation of people who are continuing to push the legacy of GLAD. And I think that access is critically important for us to continue to build out the electronic platforms. I know, Alvin, it's hard. It's very hard for me to find time to do anything, and so, being able to have access. If Jamil decides he wants to do spine, he says, let me call Barrett, or how can I access him? What's the easy way to be able to access him conveniently? And he can shoot me an email or text me. I think as we continue to build and grow that platform, the power of the GLAD Society is only going to continue to expand. But, it's hard to put into words what GLAD has done for me, man. I can't tell you any number of times I walked into GLAD. I remember meeting Michael Trice, just these guys that had incredible impact on me. I said Eric Carson, all these, profound impact. Like, I literally leave the meeting and feel energized and refreshed and ready to go fight the world. Because, you're going back to Pittsburgh and there's no other Black folks doing orthopedics. So you got to take that, you got to bottle it up, and then you got to go and put your head down and fight those battles. So, I feel incredibly blessed to be a member of the GLAD Society. All the societies that I'm a part of, I can tell you unequivocally that this is the one that gives me the most joy, and the one that I'm proudest to be a member of. And I look forward to trying to continue to build the legacy, to contribute in the humble ways that I can, and keep it going.
Awesome.
Great.
Appreciate your time, Dr. Woods. I want to, wrap things up by reminding our members out there, if you're watching this video, you can see more at our Gladden Society YouTube page. If you go to the Gladden Society if you search YouTube, search the Gladden Society, you should be able to find more videos, these videos with our members and other videos as well. Also, if you're interested in being interviewed or having conversation with us, letting the members get to know you, please reach out to us at info@gladdensociety.org. All right, appreciate it again, Dr. Woods, and hopefully some members will find this helpful. They'll reach out to you, and maybe we can continue to grow collectively and be more powerful together. Thank you.
My pleasure, man.
Thanks
Thank
so
you
much.
for having me.